Good afternoon. Magandang hapon sa inyong lahat. My name is Yarcia from NoBox Philippines. We welcome you to this session entitled Testing Drug Policy Frameworks Here and Abroad. I'm very excited for this session because we have very exceptional speakers who I'd say without any exaggeration are the frontliners when it comes to drug policy reform and harm reduction work. They literally have decades of wealth of experience in the field, and I'm very honored to be the moderator for today's session. Without further ado, I would like to introduce our first speaker for today. Naomi Burke-Shyne has been working to improve drug policy and advance the rights of people vulnerable to HIV. She's currently the Executive Director of Harm Reduction International, a leading nonprofit at the forefront of harm reduction responses and drug policy reform. She's a member of the Strategic Advisory Group to the United Nations on HIV and Drug Use, Global Fund Technical Review Panel for Human Rights and Gender, and the WHO Guidelines Group on Ensuring Balance in National Policies in Controlled Substances. Let me introduce and welcome Naomi. Naomi, the floor is yours.
Thank you so much, Lee. I'm so excited to be here with you, and I think we should start by commending you and the whole team at NoBox for this incredible series of dialogues this week. It's been such a live 2 days. It's hard to believe there's another 2 days to go, and every single component of the discussion is really vital. So huge congratulations to you all. Fabulous, thank you. So on the next slide, you can see that I'm going to divide my presentation today into 4 segments. I'm going to talk a little bit about the basics of what we believe harm reduction is about. Talk about frameworks for health, what Harm Reduction International tracks around the world. Jump into some case studies of best practices and good ideas from harm reduction practitioners in different countries, and then just reflect on the fact that harm reduction really needs to be a fit for the person that you intend to serve. It's about meeting people where they're at, and everybody who uses drugs has different needs. At Harm Reduction International, we talk about harm reduction as policies, programs, and practices that aim to minimize negative health, social, and legal impacts of drug use, drug policies, and drug laws. When you get into it, we kind of think about harm reduction in terms of 4 principles and 3 goals. The principles are respecting the rights of people who use drugs, a commitment to evidence, a commitment to social justice and the leadership of people who use drugs, and avoidance of stigma. And we think that these harm reduction is never really just about a set of interventions. It's about these kind of holistic principles that are about approaching the idea of engaging with people who use drugs and engaging with the idea of drug use without stigma or judgment. And the 3 goals of harm reduction as we see it are firstly to keep people alive and encourage any positive change in their lives. To reduce the harms of drug laws and policy. We know a lot of the impact of drug policy is negative. The policing, criminalization, and punishment associated with drug laws and policy around the world are deeply problematic in terms of preserving the rights and the health and the safety of people who use drugs. And then the 3rd goal of harm reduction, as we frame it, is to offer alternatives to approaches that seek to prevent or end drug use. For us, it's all about the individual choice. It's great if a person decides that abstinence is the best option for them, but we want to open the door and meet the person and ask what they need, as opposed to predetermining the best outcome for them. So some important international frameworks to kick off my talk. It's important to know that harm reduction isn't something that we're making up on the fly. We've got broad international consensus on the ways forward, on the evidence base, on the best ways to do this. So even before we hit the 2019 ministerial declaration in the first point there, it's worth mentioning the 2016 UN General Assembly Special Session on Drugs was a really important step forward in global consensus on the role of human rights at the center of the response to drugs. It dealt with arbitrary arrest and detention, torture, access to legal aid, and began to bring together the ideas of drug control and health and rights in a way that hadn't really been consolidated before. And in 2018, we saw a really important move from the UN. The UN Common Position was adopted, And the common position is the agreement of all the heads of UN agencies to say this is going to be our coherent approach to drugs going forward. And that emphasised that the importance going forward of promoting alternatives to conviction and punishment in appropriate cases, including the decriminalisation of drug possession for personal use. Then again, we saw an echo of that at the 62 session of the UN C&D, the Commission on Narcotic Drugs. And at the bottom of the slide there, I've got two really useful guides for anybody taking work forward in this area. The International Guidelines on Human Rights and Drug Policy. What I really love about them is they're broken down into kind of a thematic structure. So, for example, if you're there thinking, well, what has drug policy got to do with the right to privacy or the right to enjoy cultural life? You don't need to understand where the international law is. You can just go to the privacy section or just go to the right to cultural life section. So the thematic aspect of that is really easy to kind of find the laws and the policy and the international jurisprudence on what would help you. And then finally, my all-time favorite is this publication by the International Network of People Who Use Drugs. It's called Words Matter, because we import a lot of stigma into the language we use around drug use. And that's why I don't use terms like drug abuse or addict. I think it's really important that we neutralize the language that we use when we go into these discussions, because we can't begin to kind of rethink what we've learned over the years and rethink everything we think we know unless we're using language that doesn't kind of lead us off in a different direction. And so I'd recommend everybody have a look at that Words Matter publication. Finally, it's probably worth mentioning, not just because Harm Reduction International is the proud host of the international conference, but because it's a huge part of how I see harm reduction. It's about diverse groups coming together, respecting each other's viewpoints, very much what Lee just said, and trying to work out like complex issues. And at our last conference is a photo from Portugal, where we had government, community leaders, police, lawyers, doctors, outreach workers, policy people, UN. It's everybody coming together because they have a shared interest in working towards healthier, safer communities. And our next conference will be in Melbourne in 2023. So this second session of the presentation, I'm going to talk a little bit about what we know about harm reduction around the world. Every 2 years, since 2008, Harm Reduction International has tracked where harm reduction interventions take place and whether or not there's harm reduction mentioned in policy documents of all the countries around the world. And this is from our study at the end of 2020. And we know that there are 87 countries around the world which explicitly mention harm reduction in their national policy documents. And that's a really strong step forward. It gives you a framework from which to kind of draw upon to begin to implement policies to help people who use drugs. This slide is about needle and syringe programs. There are currently 86 countries around the world that implement needle and syringe programs, and those are all the countries in red that you can see on that map. They're really widespread, accepted in terms of like an evidence-based approach to reducing the transmission of bloodborne diseases. Now, the World Health Organization recommends that for every person who injects drugs, they receive 300 sterile needle and syringes every year. And this map doesn't indicate whether we've reached that high level of coverage recommended by the WHO. It just shows that the country is trying that approach. Equally, another key harm reduction intervention is the availability of opiate agonist therapy. And you can see around the world where opiate agonist therapy is available for people who use opioids in the community and also in prisons. Opiate agonist therapy is increasingly made available in prisons, acknowledging the pain and withdrawal symptoms if somebody is put in a place where they can't access their normal supply. And again, thinking about WHO recommendations, the World Health Organization recommends for every 100 people who inject drugs, more than 40 of them are offered access to methadone and buprenorphine, which are the two most common opioid agonist therapies. Finally, just worth pausing on hepatitis C, because amongst the 11 or 12 million people around the world who inject drugs, more than half of them have had Hep C or are living with it currently. And there are now global goals for the elimination of hepatitis C by 2030. For the last 10 years, there, for the first time ever, has been a cure, direct-acting antivirals. And so, there's been a real shift in what is feasible in terms of elimination of Hep C in the past 10 years. So it's quite exciting that we're charging towards a global goal of elimination, but also not going to reach that global goal without involving people who inject drugs. And finally, at Harm Reduction International, we also know that the implementation of harm reduction services costs money. These are health economics decisions, and these are important resources that need to be made available. So you can see down the bottom there the figure of 1.5 billion. That's what UNAIDS said was required annually by the year 2020 in order to meet the needs of people who inject drugs in low and middle income countries. And you can see from the green slice of the pie above it, we were nowhere near meeting what the resource needs were, which kind of speaks to the shortage of funding for harm reduction around the world. And we're actually just about to publish some new research on that, which I'm really excited about. So I've highlighted for the purpose of this conversation 3 kind of areas of case studies to talk to you about, and hopefully get to chat to Doc Benj and Olivier about it after their presentations. I wanted to start with like an all-rounder, the Community Drop-In Center. And I wanted to use the example of Adelaide from Brazil. They're based in Sao Paulo. And I should say, all of my knowledge of these harm reduction services are obviously from pre-coronavirus era. I can't really speak to, the disruption to services that each and every organization has experienced in the past year. But we can kind of refer to the beginning of 2020 as our baseline. So Adelaide has a drop-in center for people who use drugs. And it's a partnership of 2 community-based programs. I don't think there's government involvement in this one, but there are in some of my other case studies. And they offer primary healthcare services. They offer linkages to other care. They offer food and hygiene services, which is really important because if you're using drugs and you're living on the street or having a really hard time financially, these things kind of really improve the quality of your life. Interestingly, Adelaide also offers legal advice. They have access to paralegals and lawyers. And I know in the Philippines, there's that great group, Street Law PH, that is attempting to do some similar work. And then finally, they are beginning to look at treatment for people who use cocaine derivatives, which is the most relevant drug in Brazil at the moment. A lot of what we kind of grappled with in the harm reduction sector in the 80s and the 90s, and even part of the noughties, was opioid-based harm reduction. And we know around the world, thanks to data from UNODC, that stimulant use, amphetamine use is on the rise in almost every region around the world. And so there are an increasing number of programs really seeking to get to the point where they can offer useful services for people who use stimulants or amphetamines. Drug checking programs are a really good example of that. And I know there was a session right before this about drug checking programs. And again, drug checking programs, we see increases in different parts of the world, but not really comprehensive coverage. And at Harm Reduction International, we see many drug checking services around the world kind of designed to support festival goers and young people, which is fantastic. But the ultimate goal is that for anybody that chooses to use drugs, they also have access to information about what's in the substance they purchased before they put it in their body. And I think that would be revolutionary in terms of health and safety. We also have a brilliant example from Charisma in Jakarta, who piloted a Shabu outreach program maybe just 2 or 3 years ago. So they're doing distribution of safer smoking kits and plastic straws for people who snort. A huge part of their program is working on trust-building activities. I think we can't underestimate the significance of how criminalization sits really heavily with people who use drugs. Because, the whole time, if you're feeling hunted and you're committing illegal activities according to the national law, you feel constantly under threat. So a really important part of harm reduction for stimulant users is making sure there's a safe connection and trust between the service provider and the person who uses drugs. And obviously peers, people who use drugs who are acting as service providers and also connecting with the community are a really critical way to do that. And in Charisma, there's actually really great examples of peer-led harm reduction self-help practices. So just sharing the little tips, making sure you're hydrated, you've had enough sleep, you've had something to eat, the things that kind of make people feel a little bit more stable and safe while they're using stimulants. The other things Charisma do really well are harm reduction education, linking people to hepatitis-C and HIV testing, and sexually transmitted infection testing and treatment. I think an important thing to note for Indonesia is that national guidelines are really important to helping Charisma get this off the ground. And interestingly, we see some similar work being run in South Africa by SANPUD, the South African network for people who use drugs, and by TB HIV Care. And a nice component of what they do there in South Africa is they have these mindfulness sessions. So like focusing on your breathing and your awareness of the moment around you and just basically slowing your body mechanisms down, which is a nice counterpoint to stimulant use. Another really interesting case study we're seeing emerging is one in Czechia, formerly the Czech Republic in Eastern Europe. So there are about 15 to 20,000 people who use stimulants, methamphetamine, every day in Czechia. And so last year, it had been going on kind of informally for a few years, but at the onset of COVID, the government was deeply worried about what would happen to disrupt drug supply. And so rather than thinking, well, people will be cut off from their access to methamphetamine, they thought 2 steps further ahead. And they said, well, actually, if people are cut off from their regular dealers and their regular supply of drugs, they're going to start using substances that are possibly more harmful and more potent, and that will have worse health outcomes for Czechia. And so they formally introduced pharmacologically-assisted treatment with a medicine called Ritalin. I think its medical name is methylphenidate. And normally it's used for treatment of attention deficit hyperactivity disorder, ADHD, but they're finding it's working quite well as like a support mechanism for people who use amphetamines. And we know that British Columbia and Canada also tried something like that at the beginning of the COVID crisis. I'm not really sure how that's rolling out yet. So that's kind of a really exciting piece of progress and a useful new case study for us all to keep our eye on, particularly because I understand methamphetamine use is the predominant drug use, the drug of choice in the Philippines. And then finally, it's just worth mentioning again, it's really critical that public health systems embrace people who use drugs, that people can access Hep C, HIV testing and treatment. You know, in the Dominican Republic, people who use drugs can access ART at no cost. The National HIV Agency has really kind of pledged and gone out of its way to try to reach vulnerable populations, including people who inject drugs. In Puerto Rico, access to HIV treatment is covered by the insurance program, and people who inject drugs are also captured in that group. So just to kind of note that we should be pushing for public health systems that serve everybody in the population. So on to my last point for the session, and then we can move on to our exciting next speakers. I really wanted to make the point that that drug use, because it's criminalized, it's so easy to kind of overly simplify what we don't know enough about. And so we really need to think about harm reduction being a way of reaching out to people and looking at their unique needs. And so a really important and highly invisible population around the world is women who use drugs. There are 3.2 million who inject drugs around the world. Is that 20% of all people who inject drugs? But, you know, in my personal opinion, that's likely to be an underestimate. And there's a real lack of gender-specific programs for women around the world. And there's a really great example in Spain, actually. There's a group called Mercenaries that offer a women-only space. And it's kind of a combination drug consumption room, drop-in center for women only and gender non-conforming people. They offer sterile commodities, you know, whether it's sterile needles and syringes or straws or foil, whatever people would need to kind of reduce the idea of transmission of viruses. They offer hygiene supplies. People can have a shower when they go there if they're living on the streets. And most importantly, I think, for this space is the fact that Mercenaries works to do community activities. They do things with clients of their center that connect to the people living around the area, whether it's kind of sitting down and have a big Spanish lunch together, craft activities, they do radio broadcast shows where they just have chats with each other. I think the most important aspect of what Mercenaries achieves with this work is that it creates somewhere for women and gender non-conforming people to feel safe and somewhere to belong. And the harm reduction just follows from that, because when you're in a place where you feel accepted and there's no judgment, then you can really ask the right questions that are bothering you about your health or about your drug use. It's also just kind of worth mentioning that women are really the tip of the iceberg in terms of the hyper-marginalized populations, the intersectional vulnerabilities that, you know, LGBT people, migrants, people who are homeless, people in prisons, all these kind of additional complications that happen in life because life is messy, that really make drug use an even more complicated part of somebody's life, and how it's really important to be seeing the whole person when we start to think about harm reduction. And that's it. Thank you to Lee. You can take the floor back.
Thank you very much, Naomi. That was a very enlightening presentation, sort of an international framework on harm reduction. And I particularly enjoyed the case studies on harm reduction. community drop-in centers, the stimulants, harm reduction. And I personally think that many of the examples that you mentioned would be really helpful and beneficial for Filipinos who use drugs in the Philippines.